Yep, there we are.
Hey, Charles.
Hey, brother.
We're live, Charles.
Okay, brother.
Aloha, everybody. Aloha Friday. Damn, that week went by quick.
Oh, yeah.
That week went by quick. Hang on, let me get this thing all started here. How was your day, my friend?
Long and tiring. Long and tiring. But, hey, I'm glad to be alive.
Well, that is true. That is true. Okay, here we go. Looks like we're all set.
Yes. We
My
got
lighting is.
44 on right now with us.
Oh, that was
Welcome.
quick.
Yeah.
Oh,
But
wow.
anyway, everybody, thank you for joining us on this Friday night here on Facebook with Mel and Charlie. Hope everybody's doing okay. Kind of a disappointing day. Still haven't had any word out from the state capital or Washington Place. But
You
we've
know,
been used to that. How many times? We've been around the block a few times with the same old modus operandi, same thing
you
over
know,
and over.
I don't, I don't understand why the secrecy. I don't understand why, you know, why why are they playing games, I guess is the question I get. Why are they playing games? You know, you know that you're not going to open up August 1. You know, I mean, the bottom line is this. Everyone now, the four mayors as well as the lieutenant governor is saying that we're not going to open up. But the governor got to make the announcement. So why the hell the governor don't make the announcement? Why is it so hard, Ige, to not come out and just say that based on what's happening across the country, based on the fact that our testing capacity has dropped, based on the fact that we're seeing numbers in Hawaii grow, uh, we got to push back the start date for mainland flights. Why is it so hard? Why you keep everybody in suspense? Why you
You know
do
what?
that?
You know why?
Power and control? What is that? What it is?
What he's doing right now, he's waiting for the last test to be read. He's waiting for it so he can get those numbers, and hopefully it'll be in by early next week. And of course, the numbers going to spike again, right? But then there'll be no more testing after that, right? So there's going to be a flat, no test results. So in his mind, he think, oh, we flattened the curve. Oh, yeah, we can open now. I think that's what they're waiting for. That's the angle they're playing.
You know,
But it's
I
but
don't
it's
know.
but they're trading on thin ice if they're going to do that. That's
Well, he's
scary.
pissing everybody off. I mean, the bottom line is he's pissing everybody off, including the mayors. That I got to give the mayors credit. All four of them were all being team players throughout all of this. I just don't understand why he. Remember we talked about this. Senator Mercado Kim said hope is not a strategy. I keep saying that, but it's becoming so real. Hope
Mm-hmm.
is not a strategy. And I don't know. Hawaiian Airlines corporate sent out an email today. An email went out to all their corporate customers. Now, unfortunately, I'm not a corporate customer, but I have friends that are. So one of my friends sent me the email. Charlie, I just got them, so I'm going to forward it to you. But on the email, it was sent to all their corporate clients throughout the world. And it was a link that when you clicked on the link, it was a message from Hawaiian Air bragging about all their new flights from New York, from Oakland, from San Francisco, from Vegas, from Arizona, from all the hot spots starting August 1st. Now, the question is this. Hawaiian Air knows that the governor is supposedly going to make a statement, right? In the next day or whenever. But they chose to send that email out today. Today. They didn't wait. So part of me is, this suspicious side of me is saying, freaking Hawaiian Airlines, they know that the governor not going to lift the quarantine. So they sent out this email. This email is telling everybody that flights are going to start on August 1. That was sent out today on July 10th. So either they know something we don't, or they made a terrible boo-boo by sending that email out now.
Why? But why would they make the announcement to start selling tickets on August 1 if the governor not going to open? What I'm saying is he is going to open. He's going to open.
Well, I mean, it seems that way.
Yeah.
I cannot believe he would do that. I really cannot. With all the information that's out there right now,
Yeah.
I cannot imagine anybody that cares just a little bit about the people of Hawaii. I cannot imagine how he would not prolong the quarantine. Now you can, a couple of the mayors have kind of leaked it out. Oh yeah, he's talking about extending them another 2 weeks. How you put a date to this? You cannot put a date to this because we don't know, right? So you don't put a date. It's indefinitely until we get a handle on the cases and the testing. That's what it should say. The governor's statement should be, unfortunately, due to the fact that all of what's going on around the world, and more so in this country and in our state, we cannot open the Trans-Pacific travel on August 1st as we had originally planned. That date was picked when our curve was flat. But subsequently, we are not in a position to open up. So until we get a handle on the cases and the testing, unfortunately, we will not be able to open up or lift the quarantine on Trans-Pacific. And unfortunately, I cannot give you a date because we just don't know. See, now that's the appropriate response from anyone with half a brain. But anyway, As you can see, I'm very, very frustrated because he's toying with us. We talked about the bus. Hey, all the routes. You talk about the summer fun. No problem naming the school. Now we get 2 gyms in Honolulu. I see one of them, Egan's gym was one of them, but somebody posted that it was on Hawaii News Now. But the state didn't put that out.
Yep.
The secrecy got to stop. He's going to have a terrible time gaining back the trust of the people when this passes because of this deception, I think, that and this secrecy that's got to stop. But anyway.
Yep.
Thank you for letting me vent, bro. Now we're gonna bring in Minnie Ko all the way from South Korea. I know a lot of you guys are on here watching. We had her on before. She was quite intriguing.
Well, this time let's guide her this time. I think we got a lot of questions to ask. So I think there she is.
She's connecting to audio.
Yeah, she's connected. Hi, Minnie.
Hi, can you hear us?
Hi, Mel. I can hear you.
How are you?
Hi, Charlie.
Yeah.
How's everything in South Korea?
Good, good. How are you guys?
Hot. It's hot and muggy here.
It's hot and humid here.
Oh, really?
Well,
We're in the summer season, so it's really hot here.
Well, for those of you that don't know, this is Minnie Ko. She's a consultant there in South Korea, from Hawaii though. And I guess you travel back and forth quite well. I don't know about now, but normally you travel back and forth a lot.
I do. I go back and forth. I usually go back once or twice a month, but since January, I haven't been able to go back since the end of January.
Well, Minnie, again, for those of you that don't know, Minnie is very active in the COVID crisis there in South Korea. She's been on our show, shared a lot of, basically told us what we, or not told us, but suggested or advised us what South Korea was doing and their successes. And Minnie, I know you've been following the news in Hawaii, and it's kind of scary now in Hawaii. But before we start, I wanted to really send out our condolences to the mayor of Seoul. Gosh, it's so sad to hear that he passed away.
It was quite shocking for everyone here, and it was so sudden, and it was so sad. Yeah.
So, rough times, rough times. But anyway, I don't want to waste any time. I want to get right into the discussion because you know what's going on in Hawaii. You know that we're on the verge of opening up Trans-Pacific quarantine on August 1. The governor has not mentioned one way or the other. The four mayors seem to be opposing that. It even sounds like the lieutenant governor is opposing that. But the governor still hasn't made a statement. So how's things in South Korea from the last time that you were on? What has occurred? How's everything in Korea as it relates to COVID?
So I think from the last time we spoke, we were at about 11,000 cases in Korea. Currently, we're at about 13,000 cases. Of those cases, we're seeing anywhere between about 30 to 50 cases per day on average. Of the 30 to 50 cases, close to 50, sometimes 60% are imported cases. So for all of the cases that we have, which is a little over 1,300 or 13,000, sorry, about 13,000 cases, 1,800, about 1,800 of those have been imported cases, meaning that they're cases brought in by returning residents, by foreigners coming into Korea. And keep in mind that this doesn't also have the cases that were the people that had contacted those people and then the cases related to those imported cases. So that 1,800 is just purely from people that are coming back from abroad or foreigners coming into Korea. So the concern these days have been, although we have anywhere between 30 to 50 cases a day, anywhere from 15 to 30 of those cases are cases that are brought in from elsewhere. People have been asking, what is Korea doing in terms of quarantine and the visitors that do come in? Because we have a similar quarantine where people are required to quarantine for 14 days. Which is what we have here in South Korea as well. But in South Korea, I'm not too sure if I had shared this with you last time, is when people do arrive here in Korea, what happens is they're asked questions, they're screened, and then they're broken down into two groups. One group is people with symptoms. So if you have a fever or a cough, and that group is put in a different waiting room. And what happens is they wait there and they're tested at the airport, at a testing facility located at the airport. And so they're screened at the airport and they're put in a quarantine facility until their results come back. And so they need to stay at the airport until the results are back. And should they be positive, what happens is they're immediately moved to a hospital or a medical facility. For those who are negative, they're taken to their residence or home or hotel where they need to stay in quarantine for 14 days. And then you have the second group of people that have no symptoms coming in. What happens is they arrive, they're asked a list of questions again, and then they need to wait at the airport until a city bus comes and picks them up. So they're not allowed to go to their place of quarantine on their own. They need to wait there. And what happens is, let's say it's Incheon, where I'm at. An Incheon bus will go out and they'll pick up the group of people that have arrived. And this happens multiple times daily. They pick them up, they take them directly to a testing facility. So that's the first place that they go to, is a testing facility near their residence. So they're taken to a testing facility, they're tested, all of their information is taken down, and then another city car picks them up and drops them off either at their residence or their hotel where they're staying for 14 days. Should you not have a residence to stay at, you're either asked to leave or you need to stay in a government designated quarantine facility for 14 days. And so, either way, anyone that is coming in needs to be quarantined for 14 days. And so it's not anything that Korea is planning to lift anytime soon. And so actually beginning this Monday, this coming Monday, what's happening is they are going to require people from countries with high numbers of positive COVID-19 infections to be tested 48 hours prior to boarding. And they can only come into the country should they have negative test results. But even with that certificate, they are still going to be required to quarantine for 14 days.
Wow.
And so they're
So
ramping up the efforts.
no test. You're not coming into Korea starting Monday. No
Starting
negative test.
on Monday. And so this doesn't go for everyone. It's actually only it's a list of a list of countries, and they haven't made this list public. But they did say that what you will have to do is contact the embassy or consulate, Korean consulate in your area to find out if your country is on this list. And if your country is on this list, then you cannot enter the country without having a test 48 prior to boarding, 48 hours prior to boarding. But you also need to make sure that you are ready to quarantine for 14 days.
I want to make sure that
how America is on that list. I bet you United States is on that list. Gotta be.
you know what you just said though. I think the viewers might get a little confused because we're talking about countries. And of course, with the US, we can't do that with states. It's a totally different scenario. But I like the 14 days quarantine. I mean, but I don't know if you heard the recent news because of the high numbers in the US. Some of the leading labs, they don't think they can get the test results back in time to make that 48-hour window if they do, say if we're allowed to come into Korea from the US. They don't have that 48-hour window. So, but when we're talking about the 3 steps, you talked about one, if you're positive, you're taken to a different facility. If you're negative, you're taken to your hotel. And then you said another negative. What is it? What's the difference with that second negative, that you're taken to another testing facility and then a government car takes you to your hotel?
Oh, so I'm sorry. Maybe there is a little bit of confusion, but not too negative. So there's 2 things. If you're positive, you're taken to a medical facility and then they start to treat you. No one in Korea that's positive is allowed to stay in their homes. Everyone is taken directly out of their home or place where they're residing and put into a medical facility, whether it's a hospital or a facility that the government has designated. If you are negative, if you're negative at the airport, they take you directly to your residence or your hotel. If you don't need to be tested at the airport because you don't have any symptoms, they take you to a testing facility within the district that you're residing. And so the difference is the testing that's done at the airport is rapid testing. So these test results come back within a few hours, whereas the testing for the people with no symptoms, it takes a little bit longer, but still comes back in 4 to 5 hours. And so they're taken to another facility where they're tested in the district where they're residing, and then they're taken to their home or their hotel where they wait for the results to come back.
So the testing at the airport and the testing at the facility, that's assuming they arrive and they have no symptoms, either group, right?
Testing at they will only test at the airport if you have symptoms. If you don't have symptoms, you'll be taken on a city bus to a testing facility, and then you'll be tested at the facility.
Okay, thank you.
So regardless if you test negative though, you still quarantine. Everybody quarantines for 14 days, correct?
Everyone quarantines for 14 days. There are exceptions And so people that are exempt are diplomats. So anyone with the A1, A2 visa, they are exempt. But the difference is in Hawaii, if you are exempt from quarantine, then I believe that you don't need to be tested when you arrive. In Korea, although you're exempt, what happens is upon arrival, even though if you have a certificate that shows that you're exempt, they test you at the airport and you need to wait for the results to come back. If you're negative, they still monitor you for 14 days. So you're not required by law to quarantine or self isolate. However, they do still actively monitor you for the 14 days.
What happens to the violators? I know it's a little different up there because you know, the Korean people are much more respectful to the law. But how many? I mean, what happens to those that do try to violate the quarantine, or they leave their house, or they leave the hotel? What happens?
You know, so there have been cases where returning residents as well as foreigners have broken quarantine, and you know, they're really strict about it here. What happens is when you arrive and you're put into quarantine and you're expected to self isolate, there is an app that you need to download onto your phone, and the app basically monitors you, and it's something that you agree to before you're allowed entry into the country, that you're going to be monitored for the 14 days. um, you know, they also check CCTVs, they check the apartment camera, the CCTVs, they have footage to everything. And so should a person leave their home or their hotel, you know, they're able to find out very quickly, and they are either deported. So if you are not a Korean national, then you're deported, and there have been several deportations. Um, and if you're a Korean resident, then you are fined, and possibly you can face up to 1 year in jail. And so, you know, they've been very strict about this. And I'm not sure if I shared with you last time, but if you're in quarantine, if you're coming in from the airport and you're in quarantine, or you come into contact with the person that's positive and you're required to be in quarantine, the Korean government, whether it's the municipality or the district, they will send you care packages. And these care packages go out to everyone that is in mandatory self quarantine and isolation. And inside these care packages is not only food to keep you going for 14 days, but they also have hand sanitizers, disinfectants, a thermometer. And what happens is you are assigned a government staff, and this person will call you several times a day and tell you, okay, take your temperature. What is your temperature? Read me your temperature. And, you know, should their temperature go up, then they'll take them and they'll test them again. And so, you know, they're monitored. They're given separate trash bags that say biohazard, and all of their waste goes into these trash bags, and they're not allowed to go out and throw it away. What happens is you just put it outside your door once it's full, and then they will come and a special team comes to pick up your trash, so it doesn't get mixed in with other trash.
Now, what are your daily rates as far as arrivals? What is it right now?
I'm not too sure. The numbers that I do have off the top of my head is the daily positives of visitors that come in, whether that have been infected with the virus. And so that's anywhere between 20 to about 30 visitors per day that are bringing the virus in.
Okay, but as far as just arrivals, just saying, we're not even finding out if you're positive or negative, just the amount of bodies that come into Korea on a daily, you don't have those numbers.
No, I don't have those numbers.
Now, you know, we talked about the last time the possibility of a resurgence, and we've been monitoring the news feeds of, and In Hawaii, we're trying to figure out that when this thing started to spike again in Korea, was it new infections or getting reinfected, or if the person was infected and never got rid of the infection the first time? What's the read on that? Have they mentioned anything?
So when we did see the numbers go up, in the beginning, it was mostly people coming in to Korea, and then there were clusters that were starting to form. And so I want to say about May or June, we were down here to about 5 to 10 positive cases per day, but now we're at 30 to 50. And so of the cases that aren't visitors, they're happening in clusters. So we're seeing them at religious facilities, whether it's churches or temples. We've seen them at nightclubs. We've seen them at gyms. And so there's a lot of social distancing campaigns and campaigns uh, ramping people up and working with people to make sure that they understand going to these areas could possibly create another surge in infections. And so there are a lot of government text messages that are being sent out, a lot of alerts being sent out asking people to not visit these facilities. In terms of temples and churches, the governments and city governments have been working with the churches and temples within their area to ask them to have services online versus having people come in for services. One thing that I wanted to share with you today is a lot of the public facilities. So Korea remains open, but since we've been seeing clusters here, a lot of the public facilities, whether it's the museums or gyms, nightclubs, bars, they are now required to use an app. So anyone that goes into, let's say, a bar or a nightclub, which is where we've seen the clusters form, they're required to scan a QR code. And this QR code automatically takes down their information and the time at which they were visiting the club or a certain facility. And should a case arise from that facility, a text message is automatically sent out to the people that were there at that time. And so, this really helps a lot because in the beginning months, what had happened was you needed a lot of people, a lot of staff to track and trace, and everything was done manually. But now they're using tech and they're using these apps where, it's a lot more accurate. You're getting to the people that need the information to, they're asking them to come in and get tested. And so, it saves a lot of time. It saves a lot of work. It's very accurate. And the interesting thing is one of the people that had created this app is from Hawaii. And so I do know that he has offered it to Hawaii, the state, and the city for free. And it doesn't cost anything. It just requires people to scan a QR code before they enter a gym or scan a QR code before they enter a bar or a club, so that should there be an infection, a message can be sent out asking everyone that was there to come in and get tested.
Wow. Okay.
And you're saying that technology was offered to the state of Hawaii?
It was. I don't think they're in conversation about using it yet, but I do think that it's the direction that you want to go, because to do it manually, and if you're gonna welcome visitors into the state, it's just gonna be too hard to keep track of all those people.
Well, I don't even think we're doing it manually. I mean, there's no, no one's keeping track of who's walking into a restaurant or a bar. No one's keeping track of, and the worst part is that we just had the outbreaks at 2 gyms on Oahu. They don't even tell the public what gyms. So you know, there's a lot of gyms on Oahu, and there's a lot of people that go to those gyms, and there's a lot of people tonight wondering, was the gym I went to the one that had the cluster? And they're hoping that people at the gym is going to remember or know who was at the gym. So, you know, this is the kinds of things that drive me crazy when you have a technology, just scan a Q. Everybody has a phone nowadays. You hit the QR code, boom, your identification is there with the at the establishment. If there's a positive, all of the people will be notified, and no one's guessing anymore. I mean, I
Right,
just
right.
Well,
I'm not gonna put you on the spot and ask you for the guy's name, but I can get that offline. I want to do I do want to pursue that.
but you remember when she first came on, I think what we were hoping, you know, when you first came on, Minnie, was that with the information that you provided at that time, it seemed pretty logical. One, two, it seemed pretty concise. Three, it seems pretty darn proven. So basically, it was wrapped up in a gift package for us to use. And why we didn't use it or even delve into it, like Mel said, it leaves one to kind of scratch their head, like, gee whiz, boy. I mean, we've got all this technology around us, and we've got, you know, they always claim that, well, studies have shown. Well, studies have shown that it's working in Korea. Why don't we adapt to something like that? I mean, I can see the complexity, you know, from what Korea has and then what Hawaii has. I mean, you folks are very extensive up there. I don't know if they can even get that close down here with that. But even just to get the app on board would be a start. But not to even scratch at the surface, it makes one wonder, you know, what's happening here.
Well,
Um,
Korea had a really good model from early on. I mean, and the numbers don't lie. You know, if you look in America, we opened early. We didn't have any kind of plan in place. So right now everybody's scrambling, and really we've lost control of this virus throughout the country. Completely lost control. We got hospitals that are at capacity. I mean, you know, it's a crisis. It's a true crisis here, and no one seems to be looking at copying someplace else that is actually working. And I think that's where a lot of the people here are frustrated.
for me, what was a little bit discouraging was, keeping up with the news in Hawaii since family is there and it is home, is that I saw Hawaii will be losing half of its testing capabilities. And so that's very alarming. In Korea, they're actually, although the cases have decreased, they're ramping up their testing. And so they want to test more people and they want to sample more people. And so what the government is doing is they're working with businesses, corporations, organizations, distribution centers, senior living homes, hospitals to test all of the people there, the employees, the staff, to get a sample of any asymptomatic people that may be out there that may be spreading it within the community. And so right now is a time where we should be testing more versus, it's alarming that we're not going to be able to test to full capacity. Just to share some numbers with you, when the virus first broke in Korea in February, Korea was only able to test about 3,000 people daily. Now it's able to test over 30,000 people daily. And so, it worries me that Hawaii is losing capability of testing.
Let me ask you something, Minnie. You know, having worked in government here in Hawaii and now consulting back in Korea, you're able to see the two governments, and knowing that US, we have this constitution thing, Korea has your own constitution. If you were to compare the two, what would you say Hawaii would need to really start getting on the ball? What would you say, knowing what you know?
Our leaders, well, first, I think it needs to be a collective effort. It needs to be a national effort. It can't be state to state. State to state can manage, but it needs to come from top down. And, we just don't have that. So just looking at Hawaii alone, it has to come from our leaders, but our leaders need to be talking to the right people. You need to be talking to medical experts. You need to be talking, and not just one or two or the people that are close to you. You need to be talking to a diverse group of medical experts. What's great about Hawaii is you just take Honolulu, for example. Honolulu has so many sister cities that they could reach out to get information from, to talk to their experts, to get data from, to get statistics from. But it's not being done. And at this point, I think that you really need to listen to the medical experts and see what their thoughts are. I understand that our economy is struggling. I understand that businesses are closing. I completely understand that it's hard for everyone. But I can't stress enough that should the virus take over our state, then it's going to become that much harder. Should we open up when we're not ready? If we don't have the proper precautions in place, just because the visitor industry is, putting pressure on you to open up, doesn't mean that we're ready to open up. And, one of the concerns that I had was when our state had announced that we would be opening up on August 1st and allowing people in that had I think it was a negative test result within 72 hours of boarding. That doesn't do it, because the virus incubates in your body it can incubate in your body for up to 14 days. And so should you be exposed to the virus 2-3 days prior and it's still incubating and you get tested and you have a negative result, you could go to Hawaii and a few days later you could have the virus and be spreading it to our community in Hawaii. And so that's alarming. And what's also alarming, was raising some flags for me was we had said we're going to open up on August 1st, yet no intergovernmental communication was done. And so it's just us saying that we're going to open up on August 1st, yet countries that you want visitors from, like Japan, Australia, New Zealand, Korea, all of these countries require a 14-day quarantine for people that are coming back. And so I don't see average normal people taking vacation to Hawaii to get tested, take a vacation to Hawaii for a few days, and then return back to Japan or Korea or Australia, New Zealand, and need to quarantine for 14 days, stay in isolation for 14 days. And, speaking with, I can't speak for other countries, but speaking with some of the contacts that I have in Korea, the government contacts have said that no one from Hawaii has reached out to Korea about creating a travel bubble where, should they return with negative results from Hawaii, that they'll be able to be let in without having to quarantine for the 14 days. And Korea, the people that I've spoken with in the Korean government have said that it's not something that they're even close to considering, because they are becoming more strict on letting people come back and come in. So, being tested 2-3 days prior to coming back from traveling they're going to require you to quarantine for 14 days either way. So, it's, I feel like it's misleading the public, because you're telling them, okay, we're going to open up on August 1st, but who's going to come? The people that are going to come are the people that aren't required to quarantine for 14 days. And it's alarming, because those places don't have a hold on the virus.
You're exactly right. Many of those places are just here in the United States that are going to be coming here because of the cheap flights and the cheap hotels. The governor has been talking about the bubble with Japan, but that's the only bubble he's been talking about. And again, that came, there was a big discussion for a little while, and then it ended. It just stopped, and I'm sure I know why. It's because they're not interested. It's dangerous. America is dangerous right now. It's a hot zone. We're breaking records every day. So this is not a country that people want to welcome guests from right now. I mean, it's like how we were with Italy and New York, and now Arizona and Texas and California. We don't want them coming here because they're a hot zone. I mean, what's so hard to understand? That's the frustration. I wanted to get back to the testing because apparently clinical labs is up and running, but it's the diagnostic labs that was cut. But again, because of that, the vast majority or the majority of these tests are going to be sent away to the mainland, and there's going to be a 10-day waiting period now. And they say 10 days. Remember when they were saying 10 days? I think Senator Kochi had to wait 16 days. Kahele waited, I don't know, 16 days. That's what we're going to see. So we're going to see is the numbers, the reports that we see every day are going to be so inaccurate because of this lag of testing. How is Korea doing it? How are you guys? I mean, I'm assuming your tests are all created there in Korea. You would think that a country as large and rich as the United States, supposedly, wouldn't have this issue. We wouldn't have a limit of tests. I'm really struggling with that. Other countries are not, and yet everywhere in the world, testing is at the forefront. I have not heard an expert, except ours in Hawaii, say that testing is really not that important. Only in Hawaii they say that. Everywhere else, every medical expert that's speaking from the hot zones are saying the same thing, that we got to test, we got to contact trace. That's important. I don't see Korea having an issue with test kits and labs.
So testing, there's 118 testing facilities in Korea. There's 23 public facilities, 81 medical institutions, and 14 private facilities that are able to test. And like you said, Korea actually manufactures their own test kits. There are, I want to say 5 or maybe 6 companies that are able to, that the government has approved to use their test kits. And they've actually, these 3 of those companies have been also approved by the FDA to export to the US. And so a lot of these Korean test kits are going out to the mainland US and being used there as well. In Hawaii, because Incheon and Honolulu are sister cities, and Hawaii and Korea has a close relationship, Korea had offered to provide Hawaii with test kits at cost. And, and these are test kits that have been proven to be over 99% accurate, and the test results come back in 2 hours. And it's test kits that New York uses, that California uses. The problem in Hawaii was that the labs in Hawaii had said that they don't want to use test kits that they haven't vetted. And they will only use test kits that they've vetted. And so now we have the problem that we have. And they said to vet a test kit, it takes too long, and they're not ready to go through the process. And there are already test kit companies that they're working with. And so they're not, they don't want to use the Korean test kits. I mean, I don't know what to say to that. There's test kits there that are available, and, countries like Korea are willing to provide these test kits to Hawaii, yet, we're not choosing to take,
Well,
I don't know what to say.
I will say this from your statement alone, and I'm glad you said what you said. There is the appearance of, again, it's the monopolizing when you're working with a company and you're staying within a a very slim window, because we're fighting something that it doesn't care. It's gone outside of the boundaries. And so, if I would say, if Korea hasn't had these test kits in, like, say, New York or California, then I would say, sure, we got to vet it. But, New York and California are hot zones by the thousands. So what more proof do you need? So, that's the thing that I think the viewers, I'm watching some of the comments here, and they get very, very upset, is because, again, common sense would say, what's to hurt? Just what's to hurt to just try it? Because right now, we're at a point, putting our hands out and say, we need help. But yet, you want to act like, but we want nothing but, you got professional help. What more do you want? And even the person that asking for help doesn't know what help they want. And that seems to be the frustrating part. It seems to be very frustrating.
Again, I think you got to look at the mindset, though, of our Department of Health from day one. And I mean, I get tired of repeating this, and I apologize for those of you that heard this so many times, but it was never the priority of the State Department of Health to test. It just wasn't. They from day one, Dr. Anderson and Dr. Park felt that testing wasn't as important as the social distancing and the washing of hands and all of that. Yes, we understand that's all vital, but the testing is key. But up until, I mean, even now that the state is facing this cut in the testing capacity, all of a sudden yesterday, Lieutenant Governor comes out for the first time and criticizes the health department about making excuses. Those excuses are the same excuses they were making 4 months ago, 3 months ago, 2 months ago. But all of a sudden, because it's interfering with their plan to open up tourism, now it's becoming a problem, and they're not doing their job. They haven't been doing their job from the beginning. They have not made this a priority. And in fact, that's what Josh Green said. You guys, this is supposed to be your main focus, and you haven't done it. Well, they weren't doing it a month ago or 2 months ago, but back then, everyone was praising the Department of Health, saying that they're doing such an awesome job. But that's the truth. I mean, we know this. I mean, for those of us that are on this show every night, we follow this every single night. Nothing has changed. Nothing has changed. We brought you on many months ago. Everyone fell in love with you. Everyone fell in love with the Korea's plan. We talked about you and the plan with our state Senate COVID team. We talked about you and your plan with the Lieutenant Governor. Many opportunities for Hawaii to work with exactly what you said, sister city, very close bond with South Korea, closer than any other state in the country. And we're not working with them. We're not learning from them. Why? I don't know. It's incredible. And it's obvious that the frustration is very obvious, because we feel so helpless. We can, I'll put this on YouTube and I'll put it on tomorrow. Hopefully people share it and people get to see it. But at the end of the day, it's up to the state. And their focus for the last 3 months has been on opening tourism. The pressure is insane. And I know we got 1 or 2 of you on this call that believes that we should. Look at what's happening throughout the country and throughout the world right now. This is not a virus to be playing with. This is not a virus to be hoping that it'll pass us like all the hurricanes that pass our state. That's what it is. They're hoping that we don't get hit, but it's just a matter of time. And we're not doing what we're supposed to be doing. We're not focusing on the testing. We're not doing that. And I just wish someone would listen to not just South Korea, but all the other countries that have done it right. But anyway, I have to vent again, Minnie. I'm sorry.
I worry because right before we're about to open, if we're not able to handle containing the virus with the minimal amount of visitors coming in right now, and just the community spread that's going on in our state, how are we going to handle the virus with all of the visitors coming in? It's just, that's what I worry about. And I agree that, people are there. We're all struggling. We're having a hard time. Our businesses are closing. People are losing their jobs. They've lost their jobs. They don't have basic income for basic needs. It's terrible. But I mean, just imagine what could happen with the influx and the increase in COVID-19 in Hawaii. And, we'd end up with not enough hospital beds, not enough ventilators. It's just, I feel as though that's more alarming.
Charlie and I talked about it today. It was you, Charlie, telling me about the 56 hospitals.
Yeah.
Is that you telling me in Texas or
Yeah.
someplace that
Yeah.
56 hospitals at capacity? Yes, Texas is much larger than Hawaii, but we're not immune from that, and we don't even have 56 hospitals in the state. They again, I think, and this all ties back to the lack of priority in the testing, is that they don't want to see the numbers rise. They don't want to see our numbers get high. We second to the last in the country, Minnie, as far as testing based on population, percentage based on population. We're second to the last, Hawaii. There's only one state behind us, and that was Idaho, I think, or Iowa, one of them. Rhode Island is, and we're at 5.7% of the population being tested so far. 5.7%. Rhode Island, 27% of their population has been tested. New York, 25%. There is no emphasis on testing here, and that's before we had this little crisis with the capacity of testing. But I was always my feeling was that they didn't want to test. They didn't want to test because they didn't want the numbers to get high, so it would just delay the opening of tourism. And now we see, now the spikes have occurred. We've had the clusters. Kauai, we had a couple of big clusters. Honolulu is seeing some cases again. We never even got past the first wave, and they're so interested in opening on August 1st that I'm concerned that our people are going to be at risk. I really am. And you folks seen it, Minnie. Remember patient 31? You came on, you talked about how everything was going so well, then you had one spike, and that one person just infected quite a bit of people, and it was in a club or whatever.
It was patient 31, and it was in this religious, as a church, right?
Yeah, the church.
Right. And more recently, which was maybe about a month or a month and a half ago, was the patient that had gone to the club in Itaewon in Seoul. And, through that, it infected about, I think it was 90 or close to 100 people. But the difference between that patient 31 and what we saw at the Itaewon Club was that Korea really learned from the beginning of the virus and how to handle it and how to contact every person that has come into direct contact with the positive to make sure that they come in and get tested. But not only are they tested, if you're a direct contact, you need to be in a 14-day self-isolation. You need to be quarantined for 14 days. And that's required by law. And should you break that, then you're going to be paying a fine, or you could be spending up to a year in jail. And from my experience with a few of my friends in Hawaii, is that they told me, when they were confirmed positive, they weren't even asked who they came into contact with a few days prior. And when I asked them, did you contact the friends that you met and the people that you met? And and this person said, yeah, I went and I called everyone to let them know that I was confirmed positive, and my wife is now also positive. But it's not something that's being done by the state or the city. Is you need to be going out and contacting all of those people that came into direct contact with a positive and telling them that they need to be in isolation. that they need to isolate themselves for 14 days and they should come in and get tested. Without that, it's, I feel like you have a positive and then their contact isn't in isolation and they're, running around and they're spreading the virus. It's just this vicious cycle.
Well, we know, and I talked about this a few shows ago. Was my coworker in the same office, very very close quarters. We got a small office. He came in direct contact with someone that tested positive. Direct. I mean, he was within 8 inches of this person. He didn't find out from the state. Their contact tracing didn't identify him. It was just through our office's investigation that we found out that the person that he had come in contact with had tested positive. So I'm not convinced. I'm not satisfied at all with the contact tracing. They talk about it, but what they're doing is they're contact tracing the immediate family or the immediate household of the person that tested positive. And Charlie and I talk about this all the time, where that net has to be thrown far and wide.
Right.
And that's not happening right now. And that's what there's a lot of people right now. And that's my fear. There's a lot of people right now in Hawaii, based on all the clusters that's popping up, that haven't been contacted by the state, that are out there, that have been in contact, whether first level or second level, and are out there spreading the virus as we speak. And, people always say, Mel, cannot be because nobody getting sick. Well, 40% of the people are asymptomatic. Not everybody gets sick. You can still pass the virus. So yes, we've been lucky to some extent, but we're not doing what we're supposed to do, because the focus hasn't been on that. The focus has really been on we got to open up the economy. And that's I think the disservice that is being done to the people of Hawaii.
Minnie, what is the tourism rate right now for Korea? Like Korea depends on, what's the percentage of tourists coming into Korea?
Right now, there are no tourists coming into Korea. I don't even think 1-2%. The people that are coming into Korea that are foreign are coming in for work, and they're coming in with work visas. We don't have visitors coming in. And, Korea and the contacts that I spoke with made it very clear when I spoke to them about Hawaii opening up on August 1st and allowing Korean visitors to visit Hawaii should they have the test result, a negative test result. They made it very clear. They said, we are not ready to accept people coming in without having to do the 14-day quarantine. And so, it was clear that at this point, a travel bubble was not something that they were considering.
And that's why you haven't heard anything about it. I mean, there was some talk, like I said, up with Japan, but that I'm sure that broke down. There's no way you're going to do that. I mean, not with the system in place. I did look up earlier today, the visitors to Korea, South Korea, is down about 98%. That's what it is. And, and they're talking about, like you said, the 2% is probably people coming into work, but very few people are coming in right now to South Korea, like Hawaii. I mean, from 30,000 a day, we're down to 2,000 a day, but that's growing every single day, and that's the scary part. And that's just only going to get more. Can you imagine after August 1 or whenever they decide to open up the quarantine? It's going to be a problem. It's going to be a huge problem.
No, a positive note for Korea is that the domestic economy is thriving. And without visitors coming in and without people being allowed to travel out, they are traveling within. And so restaurants, cafes, coffee shops, domestic travel, located, other cities, they're all thriving. They're doing really, really great right now.
And that's because you have a safe country. That's because you folks have isolated the virus based on your measures, right? So your local economy can thrive. And that's what we have been saying. A lot of people have been saying. leave the outsiders out. Let us focus and you never did shut down, right? Korea never shut down. You know, so we had an opportunity. We were flat for a while. That was the time to go out and support your local businesses, but we were locked down. We were shut down at the peak of our flat curve. It's not the peak, but at the valley, I guess. We couldn't. Everything was shut down or very limited. And now, as it's getting hot, we want to open up. That's what I don't understand, and it's kind of difficult. I did want to say, Charlie, I don't know if you heard this. I just saw this post on a comment. Did any of you listen to Maui Mayor's conference today? He had his doctor from Maui Hospital claiming that Maui is ready to open and ready to close down the parking lot to add beds outside if necessary. Did you hear that? Did Mike Victorino say that?
I wouldn't be surprised. I wouldn't be surprised if he did.
Yeah, no, somebody told me that Mike was holding out. He was the holdout. Out of the four mayors, he was the one. And I'm just reading this, and I have no reason to doubt this person. At Maui Mayor's conference today, he said he's ready to open up, and if needed, they'll close the parking lot to add beds outside.
Wow. Minnie, let me ask you something. A question came in about your unemployment. What's your unemployment right now in South Korea?
I'm not too sure about the unemployment rate, but there is a higher level of unemployment right now. That's because a lot of the travel industry, so a lot of the large travel related companies have closed. There are a lot of export businesses that have been affected by the virus. You know, because Korea relies on a lot of trade, it relies on tourism as well. It relies on people traveling. It's, you know, it has been affected by the virus. And, you know, there are a lot of people that have lost their jobs. And unfortunately, you know, businesses related to travel or import export that have had to close. And so currently the unemployment rate, it has gone up, but it's nowhere near our unemployment rate.
Yeah.
And
yeah.
I mean, when I say our, not just Hawaii, but our country. Yeah.
You know, I just was watching the release on Sweden. You know, they were one of the countries in the beginning that would stay open. They weren't going to shut down. And I guess things were going good. But because of the spike now with COVID, even with the country staying open, nobody wants to go out, and businesses are closing down because their own people don't want to go out. And so it kind of took their situation took a totally 180 opposite of what Korea did as far as staying open. And I think the Swedish banking officials was kind of worried that, you know, if they can't get the people to get out of that thought process, that there'll probably be even worse consequences coming out of it.
Charlie, I have those numbers for you. In 2019, unemployment was at about 3.7%. This year, it's at 4.5%.
Not that much. Okay. Wow.
Unbelievable.
Yeah.
And I'm assuming that like America, the government has assistance for these on unemployment. Do they get unemployment in South Korea? How does the assistance packages work over there?
It's similar to what we have. There has been a lot of aid going out. You know, they had not only aid going out to businesses, but people that have lost their jobs. There's been benefits and incentives going out to businesses to retain their employees. Every single household was given about $1,000 per person. You know, so it was similar to what we had back at home.
Now, another question that popped up was about your schools. I presume schools are still open. What kind of measures have been taken with schools? Because right now there's a debate that's going on in Hawaii. First, it was a 3-foot distance, and you know, the union just put up a we. And so you know, and the head of the schools, the superintendent, is leaving it up to each principal to use one of three models. Some are electing to take the hybrid, some are electing to take the distance learning, you know, stuff like that. So what is Korea doing right now?
You know, the schools the schools were one of the places that were hit the hardest because parents and teachers and educators, they worry about children being infected, and you know that's the last thing that you want it is it for to spread in school. And so the schools did open. They opened high school first, and then they opened intermediate, and now all grades are open other than daycares. And so daycares are open only to people that have nowhere else to take their children, their young children. But officially, grades 1 through 12 are open. And how they've been doing it, the challenge um, is you have students alternating days in which they're at school. And so a group, half of the class is at school on Monday, Wednesday, Fridays. The other half is at school Tuesday, Thursdays. And then the next week it changes again. And it's been difficult for the parents. But, you know, it's something that they're accepting, that, you know, the Korean people are accepting, because although, yes, it is difficult to keep track of when your child is going to be in school, when they're going to be out of school, you know, it's still better than your child being infected with COVID. So you know, it's been accepted. The schools have been going to extreme efforts to make sure that, you know, the infections don't spread in school. Should anyone that's in contact with the student be infected, a parent or the student themselves, the entire school shuts down again for 2 to 3 days. They disinfect everything. Within the schools, there's plexiglasses that have been put up. The classes, if you had a class of 30 students, you now have a class of 15 students that are there so that they can physically distance themselves. You know, when they go into school, nobody's allowed to go into school without having their temperature checked. You know, their hands are sanitized. Everyone is wearing a mask and is required to wear a mask. You have the plexiglass in front of you. You know, so they're going to extreme measures to protect the children.
Okay, so one debate that went on the inception of going back to school is that the health department felt like for the younger children, it'll be hard for them to wear the mask. In Korea, is it mandatory that they have to wear the mask?
Yes.
Okay.
And you know, on the subject of masks, you know, I can't stress enough how important the masks are. You know, and the right masks are. And I feel like we are again misleading the public by telling them, as long as you have a face covering, or you know, you have something covering your nose and your mouth, you know, it will protect you. It won't, because just a normal cloth mask, it keeps out 0% of the virus. You know, should somebody cough near you and those particles fly around, it can easily go right through that cloth mask that you're wearing. If it doesn't have a filter, it's not going to protect you. You know, and in Korea, now that we're in the summer season and it's really hot, and to wear those heavy N95 masks, it's been difficult. But you know, people, there are a lot of people that are wearing the surgical masks as well, but you know, they're still doing it because they understand, and it's been, you know, they've been informed and educated, and they've educated themselves as well, that if you don't wear a mask, the possibility of you contracting the virus is much, much greater.
Do we have any known children in Korea that have contracted the virus?
Children have. There have been a few, actually. There have been a few infants. There have been young children and high school students as well.
Any debts regarding
No debts.
no debts?
Um, there was some talk about people in Korea and China that were catching COVID a second time. Was that? I remember we had some discussion. A lot of the discussions we had on the last go around, your country was doing studies on certain things, but have you folks seen that where people actually get the virus for a second time?
They do. And, it's a mixture between them coming into contact with another positive person and getting the virus again, as well as the virus coming back. And what's interesting is that in Korea, like I said, you're required, once you have COVID, you're required to be in a hospital or a medical facility. They remove you from your home immediately and they take you to one of these hospitals, and you're not able to discharge unless you have tested negative 2 times within 48 hours. And so they won't let you leave unless you've tested negative. But what they found is that, after they've been tested negative, a few weeks later, the virus comes back and it wasn't detected in their bodies. But, one thing that they have found is for people that, where the virus comes back naturally, they haven't come into contact with another positive person, is that they're not contagious. They haven't been spreading it to other people. But if you catch it for a second time, then from someone else, from another positive, then you are contagious. So you don't develop immunities to the virus.
Okay.
And I remember that was a discussion I think we had the last time, that they were working on a study as far as the immunities, the antibodies. I mean, that's how much things have changed since the last time you were on the show. Things happen quickly nowadays. I gotta ask, how's the relationship? Has there been any change between the North and South because of COVID, or is that status quo?
No, it's status quo. The North Korea, every so often will do what they want to do, and nobody really knows what's going on there. Nothing has changed between that relationship.
Just thought I'd have to ask. I was hopeful. I was kind of hopeful that something bad like this would bring the countries together, but well, I tell you, we sat at that. I can't remember what the name of that place was, and right, because the DMZ was closed, so we went to that. It was, I don't know, it wasn't like an observatory, but it was right there on the river, and not far away, for we could see North Korea right across the river, and it was just so eerie. That feeling is so eerie because no one knows what's going on over there,
Right.
and you have family over there, right?
Uh, I don't have family, but my mom,
Yeah, your mom.
yeah, part of her family is still there.
Yeah.
And she hasn't seen, she was just 2 years old or
Yeah.
3 when they came down to the South. So, she doesn't, it's not something that she remembers.
Yeah, I was blown away. How's your mom doing, by the way? I haven't seen her or spoken to her. She's doing good. She's in Hawaii, right?
She's in Honolulu. She's actively helping the city with what, their one Oahu grant, in making sure that people are applying for this grant. But I was just talking to a girlfriend. I was texting with her, a girlfriend back at home, and I said, I feel as though I understand what my parents were going through when we were in high school. It's, they tried to keep us at home. They told us, don't go out, stay at home. I feel like, we're doing the same thing to our parents, where it's like, Mom, Dad, don't go out. What are you doing? Stay at home. Where are you? What time are you coming home? And it's just role reversal.
Yeah. Scary times. Scary, scary, scary times. Darn, I had a question and I just forgot what I was gonna ask. Go ahead, Charlie.
Yeah, just to let you know, one of the viewers said that regarding the mayor's updated conference open, uh, had some the backstory to that. It had some political, and the thing was all misconstrued. So that's not true. Just for give you a heads up on that.
All right. So the outlook for Korea, pretty good. No, I mean, you guys have it down path. I mean, you guys just have everything in place. Everything's working. Your numbers are low.
You know, they are.
Tourism, still be a while before you guys see the tourism like everywhere else. It's gonna
Right.
be a while before you see tourism back to its normal rate, right?
And they don't want, I mean, the South Korean government doesn't want to open up anytime soon. You know, they want to make sure that the people here are completely safe and healthy. You know, one thing that I wanted to mention was that they are getting ready for a second wave. And, you know, they do believe that it could possibly come back in the fall and hit the country harder. So, the central government, municipalities, local governments, what they're doing is they're stocking up on PPE. There's, you know, hand sanitizers, gloves, everything that they had shortage of in January, February. They're making sure that they have that stocked. And so millions and millions of masks and hand sanitizers, each city government has that in stock, ready to go should there be a second wave.
Yeah, I worry about the second wave. I know some people think this little bump we had was the second wave, but it wasn't the second wave. We haven't seen the end of the first wave, and the second wave is, by all predictions anyway, is going to be worse. That's what the experts are saying. I mean, across the board, not just Hawaii, but I'm just everywhere. A second wave is going to be worse. So I mean, we better be prepared. And I worry for Hawaii. I don't want to say jealous, but I definitely wish we had the leadership and the guidance that South Korea has. I really think we would benefit. I wish the emphasis was put on the people and not just the visitor industry. But we just gotta wait and see. We'll see what the governor decides to do, and we should find out in the next day or two. I hope.
Minnie, for me, I'm somewhat naive about Korea because I never paid attention to it even in high school. But what's the economic engine for South Korea? What drives the economy there?
Import, export. You know, there is a lot of manufacturing, agriculture. You know, it's diverse. It's not tourism is just a small percentage of the economy here in Korea.
Because that's what a lot of people are talking about. Knowing this that there are many families that the two income earners both in the hotels, bingo, taking out one crack. So I think what the theme has been, and I've been hearing this over and over again, is trying to look at diversification now, because at one time leaders in sugarcane, islands, pineapple, but that all went to like South America and places like that. And I think it has to be started up again, because this is a telltale sign that how tourism took down the economy, and everybody needs that tourism back. But like Mel and I always said, we can bring the tourists back, but we want them to come back in a safe way. That's been our argument. If they can do it safely, then I think it'll work.
I think that you know, tourism, it's always going to be a driving force for our economy back at home, and I do believe that it's important. But I completely agree that we have to be self-sustainable. You know, we have to diversify. Should something like this happen, and it could happen again anytime, is that you have to be able to survive without the visitors coming in. And it's, I mean, Hawaii has always welcomed visitors and it will continue to welcome visitors, but in addition to that, to diversify so that it's also self-sustainable.
Okay.
Well, Minnie, thank you for joining us again. It's Saturday over there, right?
It is.
Yeah, you're taking up your Saturday, your weekend. But what would you say to our viewers? There's a lot of people watching and will be watching this. What should we as the people do, just regardless of what the state does, or what's your advice to us to get through this?
Be careful. Make sure that you are actively aware of distancing yourself from other people. Contact your leaders. Ask them to ramp up testing, not decrease testing. Wear a mask. Be respectful of others. We're all in this together. And should the people of Hawaii and our leaders work together, I do think that it's something that we will be able to overcome. But
Wise word.
you have to. You have to contact your leaders and show them your frustrations and share with them your frustrations, and continue to do that. It can't just be one industry pressuring our leaders to do something that we're not ready for.
You got it, people. Now you know what to do. Charles,
Wear
any
a
final
mask.
comments? Wear a mask. Yeah, wear a mask. I never leave home without my mask, boy. I tell you, it's always here. Charles?
Well, first of all, I'd like to say thank you again, Minnie. You've been so gracious and kind of letting us your time. Bringing, some people didn't join us the first time, but they heard about you, and I'm glad they got exposed to you via this format. So thank you so much. To the viewers out there, I think, it's been said over and over again, we got to just take care of ourselves. I mean, for now, because unless things change at the top, we're gonna be slung into something that, if we're not careful, we're gonna get hurt. And I think for those of you that join me every day when I give my safety tips, it's all about taking care of the kupunas, taking care of those that cannot take care of themselves right now, because we are treading on some very, very scary times. I think we just got to pull together, and we just got to march the same tune. And I believe we'll be okay. We'll be okay. We'll be okay.
Thank you, Charlie. Thank you, Minnie.
Thank you, Charlie.
I think, wait, no go yet. I get to do my closing now. No, I just want to say thanks, Minnie, because you bring out stuff that seems so normal, so common sense. Testing, tracking our people. I mean, I don't know. I don't think South Korea has the civil rights protesters that we do here, but nonetheless, simple things like your QR scan or whatever it is, just things that we can implement. I know Senator Kochi was on here tonight. I don't know if he's still on, but just those things, simple things, and keeping track of our visitors and our residents on quarantine. That's so critical. And then, of course, the individual responsibility to take care of ourselves. We will get through this, but want to get through it sooner than later. So again, Minnie, thank you very much. Send our love to the family and say aloha to everybody in South Korea. And I'm sure we'll be doing this again shortly. So take care, you guys. Everybody, tomorrow night. We'll see you guys tomorrow night, 7 o'clock, same place, same time. Love you guys. God bless. Take care.